Thanks for choosing to shine with us this morning. It's now time for our Health Alert feature, and today we focus on malnutrition. This occurs when a person gets too much or too little of certain nutrients. Undernutrition occurs when they lack nutrients because they eat too little food overall. We're joined by nutritionist Dr. Tameka Stephenson Harris as she shares more about malnutrition. Now, Doc, good morning.
Good morning.
I doubt a lot of people understand what really is malnutrition and how it affects individuals. Some people think that because you're skinny and you look like you're not going to survive any longer, you're malnourished. And if you look fat, you're healthy and you're not lacking anything. So let's talk a little bit about that.
Correct. So as you have highlighted earlier on, thank you so much for having me, is that malnutrition is whereas persons are not having proper nutrition. And in terms of not having proper, it has to do with, for example, you're not consuming enough of that which your body requires in terms of macronutrients as well as micronutrients, as well as you may not be able to utilize that which you have consumed. And don't forget also the overnutrition. So you have been consuming too much. And in terms of too much, you have an excess, and that excess we oftentimes categorize persons according to the body mass index chart in terms of being obese or morbidly obese. So we have persons maybe undernourished or overnourished, and both categories or both extremes are considered malnutrition. And so as you highlighted, is that oftentimes persons misinterpret being on the overweight side. They think it's okay to be in that category. So we want to also highlight that some of the things that actually increases your risk of becoming malnourished also includes accessibility to food. So you may not be able to access the food readily, even if it's available, and it may be secondary to maybe a lack of income or low income. You're not able to afford or to purchase certain items. And of course, we cannot forget the season of COVID-19, where we have had persons losing their jobs, or they may have time cuts, and so as such not able to maintain the steady income or the amount that they used to get. And also we find that persons are on the verge of those who might have been in the normal weight range has been either from one extreme to the next extreme. And we have seen that also in some of the data that were produced also by the Ministry of National Security in terms of a camp that was held in the summer. And just to also highlight as relates to the UNICEF group, so they have shown coming up to 2019 that we had malnutrition on the underweight side, where you have persons being wasted and stunted. And as we saw where it comes on to 2019, that the progression with malnutrition was decreasing, but we were faced with overweight and obesity that was on the rise. But to highlight, even in this period of COVID-19 pandemic, is that new data in July, just July, have shown that we are anticipating, according to WHO and UNICEF, that there may be an increase of about 14.3% in terms of those persons who are underweight. And again, it speaks to availability.
Dr. Tameka, I have to jump in here and ask you a quick question, because I always thought that malnutrition was just skinny or underweight, mager, as we say in the Jamaican context. So now you're saying the mal really means bad nutrition?
Correct.
So then...
So it's not proper nutrients. So you might be taking less calories, less macronutrients than your body actually needs, or you may be consuming too much. And to highlight that obesity is a comorbidity. Oftentimes persons are not aware of that. We think the comorbidities oftentimes only speak to, for example, diabetes and hypertension, but I must highlight here that obesity is also a comorbidity. And so also, not only is it a comorbidity, put you at risk of certain other ailments, which includes the diabetes, hypertension, and chronic disease, kidney disease. And so in a sense, when you have these on board, you are not able to utilize sometimes the nutrients that you're even consuming. So some persons may think that, okay, I'm in the normal weight range, but you know, what is happening? I find that I'm ill more frequently than usual. So what is happening is accessibility or the utilization of these nutrients are also disrupted. And COVID-19 has definitely disrupted our food availability and accessibility and has led to food insecurity.
So that's diet-related communicable diseases, right? The diabetes, the cancer, the whatever the case may be. Now let's talk about those who are affected by this. Who is at risk?
Okay, so persons who are at risk, we have to make mention of our high-risk group, which includes our children. So, for example, those persons, and the most vulnerable group also, those among them who are not able to access some of these. So persons in certain areas or rural areas may not be able to access some of the foods readily available. And even in the urban areas, based on the fact that they may not have, parents may not have a steady income as well as the household size to produce for the number of persons. And so persons, even at this time, who are not going out to school, we can see where that also impact that, because persons usually, some of these children would have access to, for example, school food programs, and at this point in time, they don't have access to the same. Or if something is even sent at home, for example, the PATH program that we heard the minister speaks about, is that sometimes this may not be able to feed your family of 5, 6, and 7, depends on what your number is.
Yes.
And so they are also at risk, and we find that some of them are going on the underweight, they're on the edge and falling in the underweight category. We must remember also our elderly. So our elderly population, they're already at risk. They are not able to, some of them are not able to be on the outside as frequently as they used to. And so we talk about certain deficiencies, for example, even the vitamin D deficiency. We talk about even the consumption of certain food items as well, at times right now may not be available to them. We talk about, for example, our pregnant mothers. So even in this time, you know that there is increased demand as well, and persons become frustrated based on the shock that the pandemic of COVID-19 has really put them through. And so mental health, persons with mental health, certain other physical condition, disabilities as well as certain persons with medical condition. We have seen also during this period, persons coming in the hospital is from one extreme to the next. So we have been dealing with persons who are on the overweight side, persons who not known to have any other illnesses and contract COVID-19, not doing well as it relates to COVID-19. And we cannot ignore the fact that what you have consumed also impact on your immune system. And so if you're not having adequate nutrients, you are not able to boost your immune system to help fight off this particular infection. And so we know that in the past has been proven in terms of certain infectious diseases that in terms of consumption and proper nutrient consumption have aided to improve your immune system and have helped in many ways in terms of a speedy recovery, in terms of the duration of time that is spent in the hospital. For those persons who have to undergo surgery, it also aids in the recovery period and shorten the recovery period.
So you speak about these two extremes. I just want to give me some clarity on anorexia versus bulimia and its relation to malnutrition, if you can.
So with those two, we have where persons, for example, may not be consuming, they're afraid of consuming foods because of fear of wanting to get fat. And those are some of our anorexic patients. You're not wanting to get fat, you're concerned. We have had children coming in, our adolescents, who are also concerned about the same, because sometimes they may be discriminated against based on their size and so forth. And so they may not want to consume even that which is prepared and sent for them at school, or even what is given to them or purchased at schools. And so they tend to be anorexic and suffer from certain things, for example, anemia. And we have our bulimia patients who, again, discrimination have also influenced it. And so they tend to, if they eat, what they try to do is try to regurgitate some of this food, or if they can, all of it. And sometimes it's done in hiding. And so you may have a child being at home and they think that this child is eating, and yes, man, that he's eating up well. But when you come to the hospital and we have assessed this child or the adolescent, they are underweight, they are malnourished. And when you probe some more, you get to find out that there are other things that are influencing the child's eating habit, or even after they have consumed, has tried to stick the hand in the back of the mouth in order to carry up that which they have consumed. And when that happens, therefore, you lose the weight and you don't gain as you should to remain in the healthy weight range, because of course your body, we speak about utilization, is not able to utilize that which you are consuming.
How do you know attack malnutrition in the population from the overfed to the undernourished? Doctor? Are you able to hear the question, doctor? Doctor? No.
I'm not hearing you, sorry.
Are you able to hear that question?
No, can you go ahead, please? I wasn't hearing you.
Just 30 seconds here. How do you now attack the malnutrition in the population? The overfed and the undernourished?
Okay, attacking nutrition, the underfed and the overfed in the population, whereas we want food mobilization, adequate food mobilization, and Jamaican Highland Nutrition Network has also been aiding in the same, and that's one of their mantra. And so we want, for example, adequate food mobilization. You can contact your nutritionist and your dietitian as well, assist you in terms of that which your body so required, ensure that you're eating from all the food groups, including your food from animals, carbohydrate, as well as fruits and vegetables. Ensure that you are getting adequate rest and you are exercising. So for those persons who are on the overweight, you want to ensure that you are consuming within your required range, as well as you are exercising. As those who are underweight, you want to ensure, and you may need assistance in terms of to consume that which is required for you, as well as for an overview to say whether or not you are consuming the nutrients within the required amount. And so as a nation and as a country, that's one thing that we can actually do, is to aid in the mobilization. We know that there has been shortage on various ends, and so we are asking for cooperation, for involvement and inclusion of the private sector, the government, donors and sponsors. We have seen, for example, UNICEF have also been doing such in terms of the care packages that they are reaching out and giving to the vulnerable group and other persons. And so if we continue in this format, we can help to reduce even that number that WHO has postulated in terms of maybe 132 million over the range of this pandemic might be malnourished.
Okay, thank you so much, Doctor, for sharing that information. We appreciate it, and all the very best.